Hope your week is off to a good start. You're watching Monday's edition of COVID-19. Korea's daily caseload has dropped the double digits. While acknowledging the efforts of the public, authorities are nonetheless calling for continued dedication to containment, especially ahead of the Chuseok holiday and today's opening of schools in the metropolitan area. We start the program now with the latest numbers on the pandemic with our Kwon So-ah. So I hear there's been a decline in daily cases here in Korea on this Monday.
Yes, Sunny, and it was something authorities as well as we, the nation's people, have been looking forward to. Finally, the number of new daily cases has dropped to below 100. They declined to 82 on Sunday and 70 this Monday. And a dozen fewer than the day before, that means. And 15 of those cases were categorized as imported cases, which means local infections stood at 55. That's down by 17 from Sunday. And also another positive development we're seeing is in the metropolitan region, as we're seeing 40 cases here in the metropolitan region. That is excluding the number of imported cases in this part of the country. But that is for the first time since August 13th, meaning after the massive outbreak in the Greater Seoul area.
I see. So now, despite the drop, authorities are calling for continued caution.
Right. For one, this figure has the potential to go up as the week progresses. And that is due to the lower number of tests conducted over the weekend, cases with untraceable sources of infections, which have risen to almost 30%, and the reopening of schools, and as well as the big hurdle that we're still having, the Chuseok holiday. So let's hope this downward trend will continue. If we take a look at our graph, for the past 4 days, we are seeing a gradual decline. And also, we are seeing an almost on-week drop by almost 40 cases. 109 were reported last Monday. So let's really do hope that this trend will continue. And in total, the country now has surpassed 23,000 infections. And also over the weekend, we saw the number of recoveries go over 20,000, with 90 new recoveries reported this Monday. The death toll, however, is increasing, now standing at 385 as of this Monday. And meanwhile, Seoul, Gyeonggi-do Province, and Incheon, these places are seeing a significant drop in cases compared to a week or 2 weeks ago. But still, we are seeing that the entire nation is still dealing with sporadic cluster infections. That is why government authorities have decided to implement the social distancing measures at level 2 until September 27th in the entire country. We're seeing double digits in Seoul and only Gyeonggi-do Province today, as well as when it comes to the imported cases, which stood at 15. Those came from countries such as India, Russia, and Japan as well. And those are also countries that we're seeing here with the highest numbers of infections, such as Russia and India that I just mentioned. And we also are going to talk about Japan later on, and also how the new government there will deal with the pandemic from here on. Now let's take a look at some of the figures. 7 million in the US, and also India's death toll is similar to its daily rise in cases. France, meanwhile, and yes, here we are seeing India at 87,000. This is about the number of new infections on a daily basis. And Mexico here has almost 700,000 cases now. Let's now go over to France, which has surpassed Chile in total infections. And this country is still reporting some 10,000 cases on a daily basis. In the meantime, Turkey has exceeded 300,000 cases over the weekend. And those are the numbers I have for now, but I'll be back with more updates after the government briefing. Sunny?
Right, so thank you for that. I'll see you back at the desk. Back on the local front, tracing along with testing and treating is an essential part of Korea's response to the pandemic. In this next report, we tell you more about the act of tracking the steps of an infected person to stem further infection.
In February, the Seodaemun-gu District Office in Seoul formed its own independent COVID-19 contact tracing team. Under the auspices of the Central Disaster and Safety Countermeasure Headquarters to curb the spread of COVID-19.
기초지방정부는 역학조사관 기능이 없습니다. 그런데 이 코로나19가 확산되면서 저희도 신속하게 조사해야 될 이런 상황인데 역학조사관 기다릴 수 없어서 저희 스스로 동선조사팀을 꾸렸습니다. 그래서 역학조사관에 준하는 이런 역할을 하고 있습니다.
After an initial phone investigation, staff members conduct in-depth interviews with close contacts to determine the potential routes of infection.
확진자가 발생이 되면 적게는 한 조, 많게는 한 3-4조가 한꺼번에 투입이 되거든요. 그러면 이제 기존 업무를 하다가 일단은 중지하고 바로 이제 동선조사 업무를 또 하게 됩니다.
When a COVID-19 patient is reported within the district, the contact tracing team is immediately dispatched to the affected area.
확진자가 8월 24일 날 방문하신 걸로 확인돼가지고 저희들이 거기 설치된 CCTV 좀 확인하려고 그래요.
The contact tracing team is not authorized to use geolocation data from mobile phones, nor access credit card transaction records, unlike the central government. Therefore, they use other means such as on-site investigations, computer simulations, and CCTV footages after gathering clues from a COVID-19 patient's testimony. Even still, the nearly 2,500 CCTV cameras installed throughout the district are a powerful tool for the contact tracing team.
일로 들어오시는구나. 어디 갔다 오셨나 보다.
The findings of the team often provide crucial information that can aid the decision-making process of state epidemiological officials and health authorities.
확진자가 진술을 할 때 거짓 진술하거나 아니면 정확하게 기억하지 못한 경우에 저희들의 동선조사팀이 굉장히 유효하게 작동합니다. CCTV만 분석해서 또 현장 방문하고 이렇게 하고 있습니다만 앞으로는 역학조사 기능 자체를 우리 기초지방정부에 권한 이양을 해서 신속하게 조사할 수 있도록 했으면 좋겠다고 생각합니다.
Even though many workers are exhausted 8 months into the pandemic, they continue to soldier on with a sense of duty.
저희가 조금이라도 더 빨리 움직이면 접촉자를 파악하고 이런 식으로 감염병 차단되는 거기 때문에 그런 작은 제가 할 수 있는 작은 범위 내에서 최선을 다하면 이러한 사태가 빨리 끝나지 않을까 해서.
확진자 동선이 또 규명되어서 더 이상 또 확산되는 걸 방지하고 멈추는 날이 빨리 다가오기를 바라는 마음으로 하고 있기 때문에 물론 다니면서 좀 힘든 부분도 있지만은 그래도 그런 사명감으로 이렇게 잘 하고 있습니다.
It's a little after 2 in the afternoon here in Korea, and we are waiting for the regular government briefing on COVID-19 here in this part of the world. Schools in the metropolitan area have opened today to minimize the risk of infection. Kindergartens, primary and middle schools are keeping their attendance level in each class to 1/3. High schools will keep that rate at 2/3. The only exception to the rule are classes for seniors, which are not subject to these restrictions. Meanwhile, against this backdrop, the number of daily infections has been standing in the double digits since this past Sunday. Despite the optimistic finding, though, authorities are urging for continued caution, especially ahead of the Chuseok holiday next week. And speaking of the lunar autumn festivity, as part of efforts to discourage travel during the family holiday, dining and drinking establishments at rest stops, that is, will be allowed to offer takeout services only. Also, highway toll fees, that is, will be collected this year. Now, previously, such fees were not collected during the Chuseok holiday period. Relevant officials have also decided to close national cemeteries during this period to again discourage the mass movement of people. Chuseok calls on family members to pay their respects to their ancestors as well. But this year, in light of the pandemic, authorities are calling on the public to refrain from activities that could trigger another large-scale outbreak. Now, such concerns have resulted in an extension, that is, of current level 2 social distancing nationwide for another week. Gatherings of more than 50 indoors and 100 outdoors remain banned. Professional sports games can only take place in the absence of spectators at stadiums. And operations at high-risk establishments, including buffet restaurants, clubs, bars, singing rooms, and cram schools of more than 300, will be banned. But internet cafes, however, have been removed from the list of high-risk venues and are allowed to open, but cannot accommodate minors nor serve light meals. And no visitors are allowed at homes for the elderly. Remote working is strongly advised for those if possible. The briefing for Monday, we're still waiting for it, and perhaps while we do, we can take a look at more information about today's numbers with our Kwon Swa here next to me. So do tell us a bit more about Monday's numbers for Korea while we wait for the briefing to start.
All right, we have 70 new infections reported as of 12 a.m. this Monday, and that means for the second straight day, we are seeing numbers below 100, as we had 82 on Sunday, and now we are having 70, so minus 12 from yesterday. That brings the total to 23,045. The death toll stands at 385, with 2 additional fatalities reported in the span of a day, and some 2,412 people remain in quarantine, while 20,248 people have made a full recovery of the coronavirus. And this 20,000 mark has been surpassed over the weekend. We have 90 new recoveries this Monday. And in the meantime, we have less than 50 cases in the metropolitan region this Monday. So that is also a good sign, because this number alone was above 100 for a long period. In fact, if we take a closer look at the figures today, 23 were reported in the capital, 18 in Gyeonggi-do province, and 2 in Incheon. So definitely a drop we are seeing. And also we have to keep in mind that the social distancing measures are at level 2 in the metropolitan region, but those have been extended to across the nation until the 27th of September, because there are still some cluster infections being reported on a daily basis in many parts of the country.
I see. And despite the drop today of 70 cases, because we had 70 today, we had 82 cases on Sunday. Now, regardless of this decline, authorities are still calling for efforts to abide by safety measures to ensure that the numbers do not climb.
Exactly, right? Yes. So there are a number of risk factors that we have to look at this time, because today, for one, students have returned back to school, and also we still have the Chuseok holiday coming up. That's beginning on September 30th, and that's why after the social distancing measures at level 2 come to an end on the 27th, on the 28th, beginning on that day for 2 weeks, the authorities will actually have a special quarantine period during the Chuseok holiday and beyond. And that is why authorities have been saying that they are going to have details announced on that special measure. Maybe we will hear of that in our later afternoon briefing, which seems to have been delayed for a few minutes.
Right. Now, the vicious trend across the world, of course, is that there's always been a rise in cases of infections after long holiday weekends, right? So,
right. And if we do take a look at the global figures, 31.2 million is what we're looking at in the entire world. And that is also why many countries now in Europe, for instance, are dealing with resurgences of cases. And that is after they have been lifting lockdowns. And also, that's the reason for why many countries like Spain, for instance, and UK and France are looking for re-lockdowns at this time of the period. And in the meantime, some 965,000 fatalities have been reported, with over 3,600 new deaths around the world. And the number of recoveries stands at around 22.8 million.
Right. Well, efforts worldwide to contain the contagion is being looked upon here in Korea as well, because we do have schools opening. Schools have already been opened in the Europe area, and there, of course, we've had resurgences as well. Now, the briefing is about to start in about a minute, they say. We're still waiting for it, and perhaps while we do, maybe we can take a look again at today's figures for Korea. I understand we have 70 cases, a further drop from Sunday's 82 cases, right, Soa?
Yes, 70 is the number we're looking at, and also the death toll is at 385, and this is actually a problem right now. The number of deaths is rising day by day, although the number of entire figures are going down, and that is because we're seeing a high number of elderly people that are losing their lives, which is why we also have 2 additional deaths reported today, raising the total to 385. And in the past 9 days, I believe the number was some over 30 people have lost their lives in that short span. So that's also a number we have to keep an eye on in the further days to come, because there are also many people in serious or critical condition.
Right, that is a concern that the government has touching upon, the increase in the number of people in serious and critical conditions. And because of that reality, authorities are worried that the numbers will further rise in the coming days. The numbers we're talking about right now, of course, is the death toll, right, Soa?
Exactly, yes. And also there are many cases that are untraceable. That percentage stands at almost 30%. On the weekend, we just had a record of almost 30%. I think it's now around 27 or 28%. So still many risk factors remain. So we should not let our guards down, although we do see a drop to below 100 this Monday.
Right. Yes, and against that backdrop, our school started on this Monday. We have kindergartens, primary, middle, and high school is back in schools here in the metropolitan area. There are some safety precautions that the government would like people to keep in mind as schools open. Perhaps we can go over a couple of those safety measures at schools, wearing your masks. Soa, what else would there be?
Always checking temperatures, body temperatures, of course, and even during the lunchtime, children should especially be careful. They have, of course, these in-between
Partitions
that
talking
we are
right.
having here in between us. And of course, not everyone is going to school simultaneously. We have around 1/3 of students in kindergartens, primary school and middle schools that are in classes, and then 2/3 of senior students at high schools. I mean, the entire high schools will have a capacity of 2/3.
Right. The seniors have been exempt from the rule, right? Because they have
their Sunung or scholastic ability test coming up in December. That's why they are going to school every day, all of them.
Right. There is much concern about the possible education divide, though, during this period, because schools had gone online for quite a while, but hopefully that will be overcome in the near future when they are at school, of course. Now, we are still waiting for that briefing to start. We have Swa and I talking about the events here in Korea on this Monday as we wait for that briefing. Now, it has yet to start, I'm told, so perhaps while we wait, we can take a look at some of the events here. Like we said, like Soa said actually, the social distancing guidelines here in Korea have been extended for a week. Those social distancing that we're talking about are the ones under level 2, of course. Under level 2, social distancing gatherings of more than 50 people indoors and 100 outdoors have been set. Professional sports games can take place in the absence of spectators at stadiums. Now, this is in contrast to what's happening in neighboring Japan, where the limit on spectators at professional sports has been lifted slightly from 5,000 to 10,000 this past weekend. Operations at high-risk establishments here in the country, including buffet restaurants, clubs, bars, singing rooms, and cram schools of more than 300 people remain suspended. Internet cafes, however, have been removed from the list of high-risk venues, and are allowed to open, of course, but they cannot accommodate minors, and nor can they serve light meals. Now, as we talked about this earlier, no visitors are allowed at the homes for the elderly, as the number of those losing their lives is on the rise, given the reality that people in serious and critical conditions are rising. Now, because the briefing is yet to start, what we will do now is we will connect to neighboring Japan, where a new leadership is seeking to better contain a pandemic that is leading to hundreds of infections on a daily basis. I have our Hiroaki Wada, a senior writer at the Mainichi, live on the line with more. Hello, Hiroaki.
Hi, Sunny. How are you?
Fine, thank you, Hiroaki. Now, I might have to interrupt our talk a little bit if our briefing starts, but in the meantime, now, Hiroaki, I understand a Japanese lawmaker of the ruling Liberal Democratic Party tested positive for COVID-19 last Friday after attending the lower house plenary session last Wednesday, where Prime Minister Yoshihide Suga was elected. Please tell us more about the situation there right now.
Yeah, that member in question is Mr. Shuichi Takatori, who is one of the probably next generation leaders. And his condition right now, according to his office, is not serious, and he doesn't have any fever, even though he is hospitalized.
Hiroaki, I'm really sorry.
Yeah.
Hiroaki, I'll have to interrupt you for a little bit because our briefing has started. I'll come back to you afterwards.
All right.
Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of September 21st, Monday, we have a total of 55 new local infections and 15 new imported cases. And the total caseload now stands at 23,045. Currently, we have 2,412 people in quarantine undergoing treatment, and 141 are in critically ill conditions. And we had 2 additional fatalities, and the accumulated death toll now stands at 385. I extend my deepest condolences to the deceased and the members of the bereaved families. It's time for us to look at the major updates on our domestic transmissions by region. In relation to the August 15th Seoul rallies, we have 3 more cases being confirmed. In total, we have 619 cases being confirmed. In relation to the rally, we have 216 cases, and additional cases have reported at 356, while 10 are police, and there are also cases are under investigations. And in Gwanakgu district, we have the office building. We have 2 additional cases there. We have 10 confirmed cases to date. In relation to Daewoo Deoville in Gangnam-gu district, we have seen that there was a link with the previous confirmed cases, and 10 have been reclassified. And currently, a total of 24 people have been confirmed to date. And in Gangnam-gu district, in relation to a communications sales company, we also have the first case of index case being confirmed earlier this month, and a total of 13 have been confirmed to date. And in Busan city, we have the Bukgu district, a restaurant there. And after we identified the first index case, we have 5 more cases being confirmed. And we have also have found relevance to another case, another cluster case, 5 of them at Kimhae as well. And a total of 11 have been reported as to date. And in Pohang, we also have a prior service center. We have 3 additional cases being confirmed. A total of 4 cases have been confirmed to date. And as of today, we have 15 new imported cases. 10 of them have been reported at points of entry. 11 of them are foreign nationals. And as for the countries of origin, we have 4 from the Philippines, 3 from India, and 1 from Japan. And looking at the past week, we have some trends that we would like to share with you. The total number of daily cases, we have seen 107 people, which is a decline by 21 people compared to the previous week. And in the metropolitan area as well, during the past 2 weeks, we have seen the cases at the metropolitan area standing at 208, which is a decline by 116.7 compared to the previous weeks as well. And we also have seen a slight decline in the number of new imported cases. And looking at the sources of infections, we have seen that 34% or 641 cases were contacts with previous confirmed cases, and 25% were related to local clusters, and also about 26% or 507 are under investigations. And we have confirmed that most of the cases were related to nursing hospitals, door-to-door sales facilities, especially the information sessions that they have hosted. And these also continue to be witnessed nationwide. And we are also witnessing cluster infections nationwide as well. Starting from tomorrow, which is 22nd, we will have the free influenza vaccinations for the teenagers below the age of 18, as well as pregnant women. And we have been expanding the number of influenza-free vaccinations to 19 million. And we also have upgraded our free vaccines to the 3rd strain to the 4th strain as well. And these efforts are to us to curb the further spread of the influenza epidemic during the winter as well. And we will be also intensifying our vaccinations for the high school students and middle school students, and also the elementary school students as well. And they also have special weeks of immunization immunization. So please take note of these special weeks as well. And in order to decline and to reduce the number of congestions at the health clinics, we also have restricted numbers of people who may visit the health clinics at a given time. So we advise you to book in advance through your phone calls or online as well. And if you have any symptoms like fever or respiratory symptoms, please postpone your vaccines. And when you are visiting the health clinic to get vaccinated, please wear face masks at all times and also disinfect your hands on a regular basis. Ahead of the Chuseok holiday next week, we also have a few words of announcement. During Chuseok holidays, we ask you to stay home as much as possible in order to safeguard the safety and health of yourself and your loved ones. And please make sure that we need to minimize our movements across the cities and provinces to lower the risks of infections as well. And as for the visiting of the ancestor graves, we ask you to visit through your online visits that we are also being available, and please minimize your stay time of stay as well. And if you have to visit these places unavoidably, please note that you need to follow by the quarantine measures at all times. When you are on the move, please wear your personal vehicles, and when you are utilizing public transportation, please utilize online reservations or mobile reservations, and please prepare your own snack so that you can minimize your time of stay at rest areas at expressways. Globally, the COVID-19 patients have surpassed the mark of 30 million, and globally we are seeing a rampant spread of the virus, and especially in Europe, the speed of the second outbreak is even faster and even wider than the previous outbreak, and they include France, UK, Israel, and Czech Republic. They are restricting the number of gatherings, and they are also imposing intensified lockdown as well. In South Korea, we have seen a slight decline in the number of confirmed cases during the weekend, but we need to factor in the lower number of testings that have been conducted during the weekend. Therefore, we cannot let our guards down as of yet, and we need to stay vigilant going forward. We have seen a slight decline in the number of patients thanks to the active participation of the public in social distancing measures, as well as the dedications put forth by the medical officials and the quarantine officials as well. And we still have many cases of incubation periods here in the metropolitan area, and we believe that they could be on a surge after the Chuseok holidays. And we believe that it is our priority to curb the spread of the virus during Chuseok and even after the Chuseok holiday. And massive outbreak could occur if we have a massive movement of people during Chuseok holidays, and therefore we ask for you to refrain from visiting your hometowns and also refrain from going to your travels and minimize social contact as well. Please note that in the May as well as July and August, when we had long weeks of vacation, we had another surge of the virus outbreak. And please remember that what we experienced back then. And please take a good rest at home during Chuseok holidays and enjoy your cultural contents that will be made broadcast online. And please also talk with your loved ones via phone calls. And the government officials and our quarantine officials will exert our full efforts to contain the virus, especially during this special antivirus period. Thank you very much.
Right, that was Chung Young, the Commissioner of the Korea Disease Control and Prevention Agency. So what was the gist of her address today?
Well, with figures dropping to below 100, the average of daily domestic cases for the past week stood at 107.4, that is, and that's down by 27. So we are seeing a decline, but still, Chung asked for vigilance, especially ahead of the Chuseok holiday. She just mentioned some guidelines for Chuseok and also for people to try to refrain from traveling around and to spend the holiday at home this year. Also, beginning tomorrow, as part of the free influenza vaccination program of the country, those aged 16 to 18 and pregnant women can get their flu shots beginning tomorrow.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, we turn back to Japan now, where I have our Hiroaki Wada, a senior writer at the Mainichi, live on the line with details about the COVID-19 situation there. Hello, Hiroaki. I apologize for the interruption. Right. Hiroaki, we were talking about the Japanese lawmaker who tested positive for COVID-19 last week after attending the lower house plenary session vote on the new prime minister. Tell us about that.
Okay. So the member of the parliament is Mr. Takatori Shuichi, and his condition, as far as we know, is stable, even though he is hospitalized. Obviously, it's an abundance of caution that he remained in the hospital. And as for his attendance at the parliament, the person who was sitting next to him decided to cancel his trip to a major city in Japan, again out of abundance of caution, but we don't really hear any additional infection due to Mr. Takatori getting the virus. So it's kind of wait and see situation here again.
I see. Hiroaki, what are the prospects on the Suga administration's response to COVID-19?
Right. As you may be aware, the new Prime Minister said in his first press conference that fighting COVID-19 is his top priority. And his health minister has told a number of TV stations here in Japan that he plans to increase the number of tests he conducts on potential patients to up to 200,000 tests per day. And he also talked about reducing the cost for PCR tests that people without symptoms are going to take. People without symptoms have to pay for their own tests. And that's why the government is talking about reducing the cost. And another thing is the possibility of a new treatment drug for the COVID-19, which is called Arirang. The Japanese maker, which has been doing clinical testing, is reportedly trying to file for its use and possibly the drug will be available by the end of this year.
I see. Hiroaki, the academic arena here in the Korean metropolitan area opened its doors today. What perhaps is the most urgent issue with regard to the education sector in Japan?
Right. The Japanese elementary, junior high schools closed for a while but reopened. But they're taking some strict infection control measures. But at the same time, the government is trying to increase the availability of online courses at elementary and junior high schools. They had a 5-year plan to implement.
Hiroaki, we can't hear you.
And now the university is a big problem because they want to increase in-person classes, but a lot of students are worried, as well as the professors. And the biggest problem is the first-year students who never really had college life because of COVID-19. They don't have friends, they don't have senior students who can mentor them. So they do want to go to school, but at the same time, college students are more active than younger students. So professors are worried about what would happen if any cluster infections happened among the students, because when that did happen earlier in this year, the college, which was a stage for this cluster infection, faced a lot of bashing from the society. So they're really worried about expanding the in-person classes. But there's a pressure from the government to do so, again, because of some students facing some difficulties adapting new school life, which is really non-existent for them.
I see. All right, Hiroaki, as always, thank you for being with us today. And to our viewers, we apologize for the slight interruption in our connection earlier.
가장 중요한 것은 교사와 학생 간의 상호 소통입니다. 온라인에서도 교실은 열리고 배움은 이어집니다.
방역망 통제 범위 바깥에서 진단되는 경우가 다수여서 지역사회 잠복 감염과 N차 전파 위험이 지속되고 있어.
Young scholars headed back to their classrooms today here in the Greater Seoul area as authorities extended the green light on a hybrid of offline and online learning. For more on this latest attempt to instill a sense of normality, I have Professor Lee Ho-kwa from Chungbuk National University. Welcome, Professor Lee. And I also have Dr. David Kwak from Suncheon University Hospital. Pleasure to have you back, Dr. Kwak.
Good afternoon.
Professor Lee, what do you suppose drove the decision to reopen schools?
The direct reason is the downgrade of social distance level from 2.5 to 2.0. Until last week, schools in Seoul metropolitan area could not open for face-to-face education, but the schools in other areas could open, so they could have face-to-face education. Now we all know that the face-to-face education can make a better and effective instruction, so that the educational gap among schools became wider, and that is a big concern from the parents. So they ask Ministry of Education to reopen the school as soon as possible. And thirdly, it is reopening the school for face-to-face education is a good way, effective way of learning. We all know that. So we have to keep the quality of education. And schools have a confidence in dealing with that pandemic education because we have experienced the last springtime.
Right. Dr. Kwak, there are those who are questioning the wisdom of opening schools at this particular point, especially ahead of the Chuseok holiday. What are your thoughts on these concerns?
Well, from a medical standpoint, it's a little bit concerning that we're actually putting people together in a confined space. The disease is spreading. As I said before, it doesn't have any preferences over any political matters. It doesn't have any preferences over, let's say, it being educational system or whether it be in the office areas. It has to do with it just being too many people in a confined space, and that's quite worrisome at this point. Except we do also realize that it is quite worrisome for students not being able to be educated at this time as well. As we have seen before, influenza season usually spread a lot through among school students, especially during the academic season. Hopefully now it won't be the case because we're keeping social distances. We'll still be wearing masks and whatnot inside the school. We'll also be decreasing the numbers down to a third or two-thirds of the class. But it still is putting people together in a space. So we have to be extra careful when we're stepping into the school zone, that we make sure to keep these students apart, not only those for older students, but also for younger students who are quite possible that they will not be so listening to the authorities and whatnot, that make sure that these children are also set apart inside the classes.
Right. Professor Lee, you mentioned this earlier, but there is talk about the academic divide in light of the pandemic. Mm-hmm. What are your thoughts on this reality?
At the beginning, from March this year, there was an educational vacuum. There was literally no education, neither online learning, face-to-face learning, nothing. But very quickly, we started to use the online learning. Then schools and students and parents, they're not ready for this new method. So big problems for getting the access to online learning. So that infrastructure problem of network, hardware, software, platform, contents, all those things were big problems during the first 2-3 weeks of online learning. But now it is much more better situation. Then the real problem came in, that is the quality of education. Yeah, quality of education, often we call that educational gap. That became a big problem from, particularly for students who need to go to the university next year, and a lot of students couldn't get a proper education during this time. So maybe we will call this generation in the future lost generation in education. But very interesting phenomena is coming from parents and educational administrators. That is, they all emphasis on asynchronous two-way communication instruction. Now, that's one way of doing the online learning, but that is not the panacea for all instructional problems. This is a very interesting situation because usually how to teach is a teacher's decision. We didn't pay much attention how the teacher make that decision on that instructional method. And that is a very professionally decided by teachers, because teachers know the students, know the contents and the environments and so on. So they are the only people who can make the right decision for that right instruction. But now, a lot of group focus on using that particular instructional method as a big pressure to teachers and also violation of teachers' professionalism. So we have to think about that very seriously.
Right. Dr. Kwak, the opening of the academic arena, as you mentioned, of course, comes amid challenges that have yet to be addressed. We have the growing presence of untraceable cases. We also have the persistent caseload. Yes, they have dropped to the double digits, but they're still there, quite near 100. How can authorities here better address these challenges while schools are opening as well?
Well, we have to sort of use all methods possible. But I know it sounds very unrealistic that I'm just putting it out there. But so if we can, as I said before, this is more of a physical matter rather than ideological matter. So if we can utilize, let's say, multiples of buildings for school instructions, why not go ahead and do that? As the professor mentioned, if we could use multimedia as resources for teaching students, why not go ahead and do that instead of actually putting people inside a single room? If we need to utilize authorities, I think it'll be better to actually utilize authorities in a matter that we implement physical distancing rather than just putting people in to instruct other people to do some so and so, because that just won't be as efficient as putting people apart physically. So what I would suggest is that if we have a limited budget that we need to implement this on, then why not use it for distancing people physically rather than hiring more people to actually instruct on others to follow their rules?
I see. Professor, now that schools are actually open, what can authorities there at schools do to ensure safety within the classrooms?
We need to practice high-level hygiene at schools. So as Professor Kwak mentioned, the decentralized, the less populated situation, that is the first priority. So now, only 1/3 of students can come to school at the same time. So the rest of those, they rotate when to come to school among the students and teachers. And the second is that schools will spend a lot of energy and money to practice the school hygiene, to take care of the facilities, places, and ask the students to wash their hands very frequently. And the minimum classroom mobility is recommended. So you can't just use the school labs or facilities for certain kind of subject not that much as before. And students will use the cafeteria lined up by diagonal line system, and then they have all kinds of facilities to protect their
air particles.
Yes, and they are recommended not to talk much. So that is a big disadvantage for education. Education teachers and students learn so much from discussion, two-way communication, but it's very limited to do that kind of practice. And also they are allowed to use their own pencils and pens, and students are not allowed to share their things. And even during the break time, they are not allowed to go out and talk to people, and not recommended to mingle with the students from other classrooms. And so many regulations in school, and they always recommend to keep the social distance. So I hope that this kind of very difficult practice can guarantee our safety and learning.
Right. Well, there is a lot of regulations at schools. I'm not sure if my teenage daughter will be able to follow all of them. But as a doctor, Dr. Kwak, speaking very briefly, what might be some issues or some measures that the students could take by themselves to ensure safety?
Well, we could suggest to them that 3 W's needs to be kept absolutely. If you can remember, wash your hands, wear the mask, and watch the distance. So 3 W's, if reinserted to the students' minds, that could be very firmly kept. I think it'll be okay.
Right, I think that makes sense, yes. All right, Dr. Kwak, thank you for your thoughts. And Professor Lee, as always, thank you for being with us today.
Thank you.
Right, well, that ends Monday's edition of COVID-19. On Tuesday, that is tomorrow, we bring you the latest on the second round of relief funds and on the fourth supplementary budget. In the meantime, do take care and do seek to do your part in ensuring public safety. Thank you for watching.